Hello, everyone, and welcome to PharmShare. So the topic of today is quite interesting, as usual. So we're going to talk about what pharmaceutical industry needs to know about the physicians and this evolving need in AI era. So joining me today, Dr. Harvey Castro. Hello, Dr. Castro. Thank you for being here. So, Dr. Castro, you are an emergency physician. You have more than 20 years experience in practice. You are based in US. You are also an author of several books, a keynote speaker, an entrepreneur. And what's most important to highlight is that you are an AI healthcare expert. Your mission is to enhance the AI competency of healthcare professionals, which is really important because you are creating that bridge between technology and healthcare. I'm trying to create the bridges between regions, and this is what I told you earlier. You are creating the bridge between healthcare professionals and technology, which is quite important and crucial. This is why it was really important for me to bring you here, and thank you for your time and your busy schedule. In order to explain to the industry what are the key elements to consider when it comes to AI tool in medical practice, especially when physicians are starting using AI, and the physicians in the future are going to use AI much more, right? So again, thank you for being here, Dr. Castro. I'm gonna go straight to the first question as usual. So my first question for you, how do you envision AI enhancing the day-to-day practice for the medical staff and especially the physicians?
Yeah, well, first of all, it's an honor to be here. Thank you so much for having me on your show. I really appreciate it and helping me get my message out to make that bridge, like you mentioned. And so to answer your question, just honestly, people ask me, hey, how can I do something today? And I want to talk to you about this because at the end of the day, we all have different ways of using AI. And we all are either early adopters, late adopters, or have no idea about these things and are staying away. And so I'm here to say that we need to use AI just like riding a bike. The more we use it, the more comfortable we get. The unknown gets out of it. And how do I personally use it in the clinics and with my patients? I'm going to go over some basic stuff, and it's going to be a little generic for everybody because I think this is so important. You know, you're in another country. I'm in the United States, but even within the country you're at, there's different regions of that country and they're different in that culture. And so one of the simplest things that I say is let's use AI. Specifically, I'm going to talk now about ChatGPT. Obviously, there's other brands. There's Claude and there's Perplexity. There's all these other AIs, but just to make the example simple. And let's say I'm talking to you, and if I give you, as your doctor, some examples from Texas, you may not understand them. You may not get it. Even down to the sports, even the words I use. If I say football, you may think soccer and vice versa. And so if I'm helping you understand something for your health and I'm using the wrong examples, then I'm doing you a disservice. And so one of the things that I'm going to say that I'm using right now is depending on the culture that I'm speaking to, I literally will use ChatGPT to help me come up with examples to identify with you. But not only that, let's pretend you have diabetes, and let's pretend you have diabetes for 20 years. The way I speak to you, I'm using ChatGPT to help me formulate how I speak to you, how I give you the discharge paperwork for your disease of 20 years. Right now, our healthcare system, and most doctors have this, when I go into the computer and I say, oh, a person has diabetes, it's just a whole bunch of words that say diabetes, but it doesn't really distinguish, are you a male, are you a female, have you had this disease for 5 years, 20 years? And so now I can use ChatGPT to help me create the way to communicate best to you. And let's pretend you speak another language and that is your primary language. Then why am I forcing you to my language when you really feel more comfortable saying another language? And so again, now, depending on what's out there, I can use ChatGPT to help me create the right words, the right ethical examples, the right examples. But then here's the best part. Now I can communicate with your language, which is great. And so now when you interact with me, you're like, wow, my doctor really understands me and really understands how to speak to me. The other thing, another example is, unfortunately, not all doctors are very empathetic. A lot of doctors are very quick to the point, and sometimes when they say certain diseases, they talk like a machine and they're not given that human factor. Well, ironically, I say, let's use ChatGPT or another AI to help me come up with the right words, be more empathetic, the way I sit, the way I communicate, and use it as a tool to make me a better doctor for you. And so those are just really quick things in the hospital system that I can do now to help you.
That's quite interesting because you are giving the example of ChatGPT, but for sure this is just a basic example for so everyone now can have access. And this is we're talking to the audience from different countries, and this is why you are giving this example, which is interesting because I have heard so many times. AI will maybe replace the doctors, but now you are showing that no, actually it will support them in being more empathic. So it's like having more empathy due to AI. It's quite controversial, right? But at the same time, it makes more sense because it would help doctors save time. And this is just you are giving ChatGPT as an example because it's something accessible for everyone. But for sure, I do think that there are so many tools available in the market that are specific for healthcare professionals and physicians. I mean, that's quite interesting. But when we talk about AI in general, something comes up every time, which is the ethical part, right? So for you, what are the key ethical and practical challenges foreseen with AI integration in the physician practice? When I talk about that, it's more about the physician perspective, but also patient integrity.
This is a big one. Obviously, we in the United States, we have HIPAA. In Europe, we're using the GDPR. Privacy is very, very important. When I say that I'm using ChatGPT, I want to make sure people understand I'm not putting any personal information, any identifiers, anything that AI could use to identify you and your privacy. Now, one of the key things with AI, everybody talks about is obviously the bias. If the algorithm is trained here in the United States and someone outside the United States is trying to say, oh, this is going to be great for, let's just pretend, breast cancer, but the algorithm, what has been trained is for USA people and populations, it may not necessarily translate to another country. So there's a bias. The other part is I'm a human being. I may think a certain way. I'm going to unfortunately program ChatGPT or any other AI into it, and I'm going to create biases the way I see the world. And then someone else outside the United States or anyone will use the AI and say, okay, this is not right. This is bias. It's giving me wrong information. And then here's the scary part. If physicians or patients are not aware of this, they're going to reinforce those biases. They're going to start thinking the same way that I'm thinking. And let's say it's wrong, then it's just going to propagate it all over the world. And so from an ethical point of view, that is one problem. The second is just transparency. Some patients don't realize that when they go see the doctor, some of the doctors and hospital systems are using AI. And so I say, we need to tell our patients, hey, we're using AI. This is how we're using it. We need to be transparent. The other thing is that I talk about is we need, I call it a food label. Just when you buy a can of beans or something, you look at it and you're saying, okay, this is what nutrition. I say we need to have this in AI so that anybody, a consumer or doctor, can pick up AI and look at it and say, oh, this is bias in this. This was not trained in this information. This is lacking this. That way, as a consumer or a doctor, I can look at it and say, okay, I need to do better at XYZ, or I need to be aware that this wasn't trained for this. So that's just some quick examples on the ethical portion and biases for using AI.
What about the medical tools involving AI that are today studied? I have seen recently a study showing, comparative results, diagnosis coming from doctors plus diagnosis coming from AI. So what do you think about all these changes? Do you think that there is enough ethical integrity in there, or do you think that it's still in process?
I personally think this. I'm a big proponent of teaching doctors and healthcare professionals how to use AI because I feel the more I teach them, the more they know what to look out for and know if this model is good or this one is bad or If a hospital system has a vendor coming saying, hey, use this product, then I want the healthcare professionals that are going to be using the product to know what to ask, what to look for, because if they don't know, then they're going to be in trouble because they may take the wrong application. The other thing I want to say is big AI companies are creating solutions, but they don't have a doctor in the loop or a healthcare professional in the loop. So when the product comes to me, I may look at it and say, I wish they had fixed this other problem, or I wish they had done this differently. But if now I'm pushing all my healthcare professionals saying, no, you need to go talk to Microsoft, you need to go to all the startups, and you need to be active when they start building, because the more active you are, the better that product's going to be for the patient.
And technology companies should come to the doctor first before starting thinking about technology solutions. And this is actually a gap that we can see in the industry and that we need to work on. So my last question is about the industry itself. So what could you suggest to the pharmaceutical industry who are watching us today about regarding the support that they could provide to the healthcare professional in using AI technologies for better patient outcomes, right?
Yeah, no, this is a great question. And I grabbed my Apple Vision Pro and I want to show these to you because this is, I think, how AI could be used with this. And it doesn't have to be this device, but imagine the pharmaceutical company. One of the biggest complaints as a doctor is my patient's not taking the medicine. They don't refill it, they don't take it on time, they don't understand. But what if I said to the pharmaceutical company, help me create some information that I can put this on my patient, and let's use the same example of diabetes, and then I can put this on, and then the patient now sees their heart, they see their kidneys, and they can see why that medicine and how it's working in their heart, how it's working in their kidneys, why it's helping them extend their life. One of the simple examples is when I was a kid, I saw black lungs from someone smoking. And when I saw that, I think it scarred my brain because after that, I was like, oh, I don't want my lungs to look like that. Same analogy. We need pharmaceutical companies to help us create this type of materials to show how their medications is saving lives, helping lives, and so that we can have more compliance. Another quick educational point is we need these tools. We need pharmaceutical companies to create some AI tools to help, again, that translation that I just talked to you, that conversational piece, so that me as a doctor, I can type in, here's the drug, here's what's going on, and then it customizes those discharge instructions for my patients in the right language, in the right culture. We all know that when we get a medication and you look at the package insert, it's like 20, 30 pages. Who's going to read that? We need to use AI to really condense it, make the key points of what really is important so that patients actually want to read it. Another quick example is, instead of people reading, why don't we create AI tools that reads it for us? We know some people in the world do not read. And so why are we forcing them to not really understand something that is so important? Let's make it easy for them. Let's create audio, or let's create files where the patient can come see me in the office and then I can give them this at discharge and they can see the discharge, and then obviously I take it back, clean it, and have it ready for the next patient.
That's amazing, especially the audio product information. That's really amazing. Pharmaceutical industries who are hearing us today are getting insight from a physician based in US who has, experience everywhere about how to use AI and how to support healthcare professionals for better patient outcomes. Thank you so much, Dr. Castro.
Thank you so much for having me. I appreciate it.